I can't explain how worrying this must be for the general public. And this is why I said that at the same time, the government and the MHRA is probably worried that we're raising these questions for the general public to think about. Because is it one of those situations, and if you've worked in government, there must be some situations where you don't want the public to know.
You're asking someone from the Ministry of Defence.
And this is what it sounds like, is that this is one of those situations where you don't actually want the public to think about it, and you try and see if you can get it sorted out as best as you can. Is that a fair assessment?
I can't think of any instance where I hid stuff. No. There are so many checks and balances that go on in the military. If we just, let's keep safety and effectiveness. I said I had an independent safety regulator, looking over my shoulder and auditing me, and so on and so forth. What I didn't say, but you've prompted me to do it, is the Army had their own regulator who would audit my team for the Army products that we were responsible for. And guess what? The Navy had a separate regulator who would come and audit. And guess what? So did the RAF. We were audited up the yin yang, which at the time is very frustrating and annoying because it's quite a distraction. But on the other hand, it does make you do the job properly, document it properly, have a good audit trail, and gives you confidence that what you're doing is safe. I don't see that with the MHRA.
I'll shift it to one of the questions that was raised. In number 5, you spoke about death. Deaths relying solely on death certification as a measure of the deaths used by vaccination could lead to circular logic. Additional methods of surveillance should be employed to accurately capture the true number of vaccine-related deaths. What exactly does that mean?
I think it was implying, I've got a copy here, it was implying that there was a bit of a culture of don't blame the COVID vaccine, don't link the COVID vaccine to the death. So you couldn't judge the number of deaths from the COVID vaccine by looking at death certificates, because certainly initially there weren't many that mentioned the COVID vaccine. There were a few.
And I think that from a practical clinical point of view, you almost have to be certain that it is the vaccine, where there is no other cause for the death before you would be able to put in that kind of certification. And the truth is that there are very few patients who have no comorbidities that would contribute to a death. And so therefore you can't be absolutely certain that it is related to it, and therefore you couldn't therefore do it. It's that kind of, as you said, circular discussion, which only can be addressed by big data. And the big data is looking at excess deaths and that kind of thing.
Yeah, you need both. You need as much evidence as you can get from the sort of individual level right up to the population level. And excess deaths is one example of population level data, but so is NHS data about admissions to ICU, outpatients, etc., etc. Cardiac arrest 999 calls, etc. How do they correlate with the rollout of the vaccine? How are they changing? And that's another observation in the report, that the MHRA don't seem to be following through on that. They promised that would be a big part of their, they called it proactive vigilance in the UK, but a few questions and a bit of digging on the internet reveal they didn't follow that through, or didn't follow it through and aren't making it public.
And that was another question that was raised about the lack of transparency in terms of the MHRA. They've been slow to respond to the requests and often applied exemptions. So what was that like from your own personal point of view?
Just annoying. It took them 8 months. People may not know this. In the UK, they are supposed to reply to an FOI request within 20 working days. If there is a body to whom you can complain if they don't, but they give them 40 working days, which is a month and maybe 2 months if you take into account this working days, not calendar days. It took them 8 months to reply to one of my FOIs, which was tell me about the delegations from the Secretary of State down to the MHRA and to the people within the MHRA. They just 8 months. It's so frustrating.